Emergency contraception can prevent you from becoming pregnant if you have had unprotected sex or you think your usual method of contraception may not have worked. A pregnancy starts when a fertilised egg implants in the lining of the womb, and it takes at least 5 days for this to happen after an episode of sex. Emergency contraception is designed to prevent an egg from being fertilised and from implanting in the lining of the womb, and it works because we have at least 5 days to stop this happening. It will work better though the quicker you take it, so don't delay. It can be used by anyone of any age who is at risk of becoming pregnant. There are 3 types of emergency contraception: the copper IUD, often known as the coil, and 2 types of emergency contraceptive pill, sometimes known as the morning after pill. The most effective method of emergency contraception is the copper IUD, and this works by preventing a fertilised egg from implanting into the womb. It's a small device and it's fitted into the uterus like this. It can be fitted up to 5 days or sometimes longer after unprotected sex, and has a 99% chance of preventing an unwanted pregnancy. It can also be used as an ongoing method of contraception for up to 5 to 10 years. It will start working as a contraceptive immediately. To arrange a fitting, you should call us or come into the centre as soon as possible to ensure that we can fit it in time. We fit IUDs routinely Monday to Friday, and some GPs fit IUDs as well. There are 2 types of emergency contraceptive pill: levonorgestrel, usually known as Levonorel, and Ella-1. Both work by preventing or delaying ovulation, which is the release of an egg from the ovaries. Once an egg has been released, it can be fertilised immediately if sperm are present and waiting. So, if you have already ovulated or you're on the point of ovulating, neither emergency contraceptive pill will work. You should come in as soon as possible and take the emergency pill to give it the best possible chance of working. Please don't delay. If you have already taken the emergency pill but would like an IUD, you may still be able to have this fitted. In fact, we recommend you take the emergency contraceptive pill as soon as possible, even if you are planning to have an IUD fitted, just in case we cannot fit the IUD or you change your mind. Emergency pills can be obtained from sexual health clinics like ours, GPs, pharmacies, walk-in centres and A&E. Emergency contraception is free of charge on the NHS, but you may have to pay for it at some pharmacies, depending on which pharmacy you use and how old you are. Have a look at our website for more information. Emergency contraceptive pills are not as reliable as other methods of contraception, such as the pill, the implant, the injection or the coil, and they should not be relied on other than for emergencies. In fact, you can still become pregnant later in the same cycle if you have unprotected sex, even if you have taken the emergency pill. It is advisable to start a regular method of contraception immediately after taking levonorgestrel or 5 days after taking Ella-1. It is important to check that you are not pregnant after using emergency contraception, and we recommend a pregnancy test 3 weeks later, as your periods afterwards may not be regular. Similarly, if you've quick started a regular method of contraception, your periods will be changed too. Neither emergency contraceptive pill will harm a pregnancy if you should become pregnant, however. And don't forget an STI screen if you've had sex with somebody new. If you are unsure as to whether you need emergency contraception or not, phone our nurse helpline for advice as soon as possible. Someone will phone you back within a very short time and advise you what to do. Alternatively, come into the centre and explain that you might need emergency contraception. The telephone numbers and our opening times are on our website. Remember, seek help and do something about it now. Please don't delay. Crossing your fingers will not work.